Hey everyone, it's great to see you here again. Let me ask you something. Have you ever tried to compare Medicare plans online and thought, why is this so complicated? Well, this year, that frustration might be stronger than ever. The government just launched a brand new Medicare Plan Finder portal that was supposed to make everything simpler, faster, and easier for everyone. But instead of clearing up confusion, it's actually creating more of it. And some of these mistakes could end up costing people real money if they were not caught in time. Before we dive in, I'd love to know, have you ever had trouble comparing or switching Medicare plans? Let me know your experience in the comments below. When the new portal launched in mid-2025, it was meant to be a one-stop shop for comparing plans, doctors, and hospitals all in one place. The goal sounded great, but when open enrollment began on October 15th, many people quickly realized something was off. The system was showing inaccurate information, sometimes listing the same doctor as both in-network and out. Imagine trusting that information, signing up for a plan, and later discovering your doctor isn't actually covered. That kind of mistake can cost hundreds or even thousands of dollars out of pocket, and the errors can be as small as how an address is entered, like typing Suite 100 instead of Saint 100. Those tiny data mismatches can completely change how a provider appears in the system. Small details, but huge consequences. These glitches aren't isolated either. Reports of inaccurate data have come in from multiple states and across different providers. One 69-year-old cancer patient from Massachusetts said she discovered new daily hospital charges and a $1.48 monthly premium on her plan when it used to be free. For someone managing long-term care, that's a major and unexpected burden. The Centers for Medicare and Medicaid Services, or CMS, has acknowledged the issues, citing both user interface and data alignment problems. To their credit, they've created a special enrollment period, so anyone who selected a plan based on wrong information can switch later. But that only helps if people actually know about it. So why was this launched if it wasn't ready? CMS rolled it out as part of a modernization initiative called Make Health Tech Great Again. The idea was to connect scattered healthcare data from hundreds of insurance companies and hospitals into a single digital system. On paper, it's a great idea, but in practice, it's like trying to fit together 1,000 puzzle pieces from different sets. Every insurer, hospital, and clinic uses its own technology and data standards, and getting them all to sync perfectly is a monumental challenge. To understand why this matters so much, it helps to look at the bigger picture. Over the past decade, Medicare Advantage, the private alternative to traditional Medicare, has grown dramatically. It now covers more than half of all Medicare beneficiaries. These plans often come with extra benefits, like dental, vision, or hearing coverage, but they also have narrower provider networks and more restrictions. That's why having accurate data about which doctors and hospitals are in each plan isn't just helpful, it is absolutely essential. And these things are even trickier. Major insurers like United Healthcare and Aetna are raising premiums, cutting perks, and even dropping some plans altogether to manage rising medical costs. That means more than 1 million people could lose their current coverage next year. On top of that, the number of available Part D drug plans has dropped from over 700 a few years ago to about 360 now. Many of those that remain have switched from flat copays to percentage-based pricing, so if your medication is expensive, your costs will be too. The perks that once made Medicare Advantage so appealing are also starting to disappear. Benefits like grocery cards, gym memberships, and over-the-counter allowances are being reduced or removed altogether. Some insurers, like Humana, are keeping these benefits to attract new members. But overall, the trend is clear. Fewer extras, higher costs, and more complexity for seniors trying to navigate their options. Insurance brokers are feeling the impact as well. Many are seeing their commissions cut for certain plans, especially the ones insurers are trying to phase out. Most brokers genuinely want to help their clients, but when some plans no longer pay well or at all, it naturally affects what options they highlight. That doesn't necessarily mean bad intentions. It's just another layer of complexity in an already tangled system. All of this points to a deeper issue in our healthcare system: the lack of standardized, centralized data. Even within a single hospital, one doctor might be in network while another isn't. One department might accept your plan, but another won't. The idea of a national provider directory, a single, accurate, real-time databases. An excellent one. But making it work requires coordination among hundreds of private companies, each with its own data systems, incentives, and priorities. Without that alignment, even the best technology can give misleading results. So, what can you do right now to protect yourself? First, if you're using the new Medicare Plan Finder, take screenshots of every page you rely on. Print out your plan summaries before you finalize your enrollment. Then, call your doctor's office and your insurance provider directly to confirm they're actually in it. It might take a few extra phone calls, but it could save you hundreds or even thousands $. And if you find out that you made a decision based on incorrect information, remember that CMS has created a special enrollment period just for that situation. It is important to understand that the new Medicare portal wasn't built out of bad intentions. In fact, it is a step in the right direction. Genuine attempt to make healthcare data more accessible and transparent. But technology is only as reliable as the information behind it. It's like building a beautiful house on uneven ground. It might look great at first glance, but it won't be stable until the foundation is fixed. And as more of our healthcare moves online, the need for accurate, consistent data will only grow. So, if there's one big takeaway, it's this. Technology can be incredibly helpful, but it should never replace human judgment. Don't just trust what you see on a screen, use it as a starting point, but always verify before you make big decisions. Stay proactive, ask questions, and protect your health and finances by double-checking every detail. You have the right to accurate information, and the more you know, the better you can advocate for yourself. So, what do you think? Have you tried the new Medicare Plan Finder? Did it make things easier? Or did it leave you more confused? Share your experience in the comments. It really helps others who are going through the same process. And if you found this helpful, don't forget to hit the subscribe button and turn on notifications so you don't miss updates. Medicare is changing fast, and staying informed is one of the best ways to make smarter, safer choices for your future. Thanks for watching, and take care of yourselves.